everybody has biases that they come with, but um, in this situation, it's kind of you really need to check your bias at the door, to actually help.
Imagine being in the worst pain of your life, and the only place where you can get treated is also where you've experienced racism and discrimination. That's been the experiences of Canadians living with sickle cell anemia. Gabriel Badejo has made over 90 trips to the emergency room in his life.
It's kind of a rare event that I have like a good a good experience.
It's a common feeling among people who have sickle cell anemia and experience what's called a pain crisis. It comes unexpected.
It's very, very painful, like excruciating pain.
Described to be worse than giving birth, Black populations are disproportionately impacted, and oftentimes going to the hospital is a last resort because
There's no urgency. They don't believe that my pain is this high. They might think I'm drug seeking.
the longer it takes to get treatment and pain meds, the more time spent in hospitals, days, weeks, sometimes months.
Why even go to the emergency department if I'm I'm just going to be without pain meds or without care for like hours?
Though Gabriel says it's getting better, there's still lots of work to be done.
They are being judged. They are being discriminated.
Advocates have been calling for standardized care for years now. In 2017, the Liberal government released a clinical handbook. In it, that racism towards patients with sickle cell exists and ways to address it. Also,
A sickle cell patient should receive analgesia, which is like pain medication, not more than 60 minutes of presenting in the ER. Currently, that is not the case.
more recently, the NDP introduced a bill to establish universal protocols for patients accessing treatment at hospitals. A second reading is expected this year. Sickle Cell Awareness Group of Ontario says it's working with the Ministry of Health to have posters on the correct procedures to treat patients plastered in ER rooms and putting in place a process that will allow patients to report negative experiences.
Individuals with cancer are not discriminated. They receive care on time. Yet individuals with sickle cell goes through discrimination. They have to prove that they do have pain.
Education to address biases in healthcare also key.